Thank you very much, Madam President. RNAO's annual media awards honors journalists for outstanding work, helping Ontarians better understand nursing, health, and healthcare stories. Stories published or broadcast in Ontario are eligible. Entries are scored by independent panel of judges consisting of nurses and journalists, and many times those journalists are actually past awardees. Access to accurate and trustworthy reporting is essential, and I think you all will concur that it has never been more essential than these days of fake news everywhere in social media where people invent the news. The reporting that we honor is reporting that is factual, is meaningful, is passionate, and we want to thank all journalists for their hard work, courage, and commitment in reporting on the events of this past year. It has not been a past year for nurses, for sure, for other health professionals, and also not easy for journalists that needed many times to double, triple task. Your outstanding work highlights important issues related to COVID-19, related to issues that came up because of COVID-19. And we will now play, Madam President, the video that recognizes and honors each of this year's exceptional winners. Thank you.
I'm honored and ecstatic to receive the RNAO Media Award for my news story. I really appreciate this award because I think my younger self would be very happy. When I was 15, I wanted to become a journalist, and although my career took a different path when I turned 30, I ended up working for David Burkett at the Voice of Pelham as kind of a side job, and that's how I ended up covering this story. This story is very important to me because it sheds a lot of awareness on how important nurses are as frontline workers during and even before the pandemic. And I hope this award brings even more awareness to the fact that they need extra support and fair pay. I would like to thank my parents, my mentor Kim Yallop, and my editor David Burkett. Without their support and guidance, I wouldn't be where I was today.
On behalf of myself and my colleagues, we would like to extend our deepest gratitude to the Registered Nurses Association of Ontario for this great honor. The toxic drug supply is something that has affected Canadians from coast to coast to coast. We're also humbled because it is part of a new model that we're building at the Investigative Journalism Bureau. This story was a collaboration between ourselves and the Centre on Drug Policy Evaluation. This partnership allowed us to tell this story in a new and exciting way, which we think had tremendous impact. So again, thank you very much for this great honor, and congratulations to all the other award winners for your great work over the last year.
I just want to take a couple minutes and say thank you so much for this award. It's very much appreciated. But more importantly, thanks to all the nurses in this country who've been a rock for us the last couple of years in the face of some pretty tremendous adversity. I'm a kid of two doctors. I grew up around nurses most of my childhood, so probably more than most, I appreciate all the things that you do for us. So I would love to say thank you very much for that, and thanks for this award.
Winning this award is an affirmation that the work I am doing is both important and helping change the narrative. I am honored to receive this recognition from such a strong and credible organization like RNAO, one that believes in and advocates for better public policy. The piece that I submitted for this award takes a close look at how healthcare professionals, including nurses, are struggling to cope with an unprecedented number of drug overdoses at supervised consumption sites in Toronto. It also highlights how Canada's massive drug poisoning crisis has been exacerbated by the COVID-19 pandemic. I am passionate and dedicated to reporting on social justice issues and believe my work on these important topics is making a difference. Thank you so much for this award.
We just wanted to extend our deep gratitude to the RNAO for recognizing us with this award. This story was months in the making, and so having this acknowledgement from you, and especially from a medical health body, to acknowledge the months of work that went into this project is deeply meaningful, and so we thank you.
COVID-19 exposed longstanding systemic issues not just in Canada's healthcare system, but in the long-term care system, long-term care systems across the country. And this story focused on one long-term care facility in Ontario. It was the deadliest outbreak of COVID-19, and it exposed massive issues, not just with this home, but with the way the province handled the response to COVID-19 with some of the most vulnerable citizens. And we just want to thank the families who spoke with us, families who lost loved ones, workers inside the home who risked their jobs to speak with us, and also public health officials who also spoke with us for this story. It was incredible, and we just want to thank you.
I just want to say thank you for the award for my radio documentary, Abiola, Temi, and Sophie. I was able to produce this through CBC Radio's Doc Mentorship Program. Shout out to my mentor, Jeff Goods from White Coat Black Art.
I had a patient and I said, "Hey, mister, I'm going to take your blood pressure." And he just kind of started resisting, like moving his arms almost like away from me. He said, "Oh, you black trash people are back again."
The story was such an important one to tell, and I'm really grateful that the nurses that I spoke with were willing to share their story so honestly, because it really helped to paint a picture of what they're experiencing on the front lines. But also, other nurses reached out with their stories, and it became this issue that, even the RNAO went on to address. So thank you so much for addressing this story and highlighting it, and for honoring it in this way.
Reporting throughout the pandemic has been both challenging and eye-opening. What a privilege it's been to have several opportunities to be on the front lines with our healthcare heroes, including registered nurses and nurse practitioners.
My patient was very young, in her 40s, and she passed away of COVID. And it was like, we felt so helpless because we were doing everything we can and it still wasn't enough.
Thank you for honoring my work. Thank you for everything that you do every day despite the often difficult circumstances. I'll continue to tell the stories.
Congratulations to all the winners, and congratulations to all the members that received so important awards. I always think that is one of the most heartwarming and important aspects, alongside resolutions and hearing the discussions, to hear people to be honored in such a tremendous way. And as it relates, I think it's important for members to know, to the media awards. If I am correct, we are the only healthcare organization, not only association, that to this day continues to have awards for reporters. And you can see how important it is for them too. Thank you. Back to you, Madam President.
Thank you. So before we welcome our incoming board of directors, let's take a moment to thank our outgoing board members. From Region 2, Christy Butler. From Region 4, Anita Sang-Sit. From Region 6, Dr. Alicia Munasar. From Region 8, Regina Elliott. From Region 12, Dr. Michael Scarcello. The interest group representative, Maria Rugg. The student representative, Lale Tuner. And from Region 10, Una Ferguson. The time commitment, hard work, and inspiring engagement that they have put into our association is invaluable, and it has been such a privilege and a joy to work with you over the past few years. On behalf of RNAO, we want to thank you all deeply for your exemplary dedication and active participation on RNAO's board of directors. We look forward to continuing to work with you as members. I've heard from you many times that your volunteer commitment with RNAO is not done, and I look forward to continuing to work with you. I would now like to recognize our 2022-2023 Board of Directors. Dr. Claudette Holloway as President, Rachel Elliott, Region 1, Dr. Loretta McCormick, Region 3, Michelle Heyer, Region 4, Lori Webel Edgar, Region 5, Ike Ajisi, Region 6, Dr. Soyan Sito, Region 7, Kathleen Picard, Region 8, Deb Lefebvre, Region 9, Ellen Shipman, Region 10, Maxine Lesage, Region 11, Sue LeBeau, Region 12, Julie Rubel, the interest group representative, Lamal Dolkar, the interest group representative, Rebecca Titus, the student representative, and Dr. Doris Krinspan, our CEO. Congratulations to you all. I look forward to working together over the next year. Now it's time for the president report, which really is just to say such a huge thank you to all of our members, all of our RNAO staff members, to Dr. Grinspan, for all of the support and dedication to RNAO that I've seen over my past 2 years as president. I can't believe that my entire 2 years of presidency has been done throughout a COVID pandemic, and that it's been a number of virtual meetings that I have had to lead and facilitate. I never thought when I put my name forward to become president that it would have been all done through Zoom, but it has been such a rewarding experience for me. It has been time consuming. It's been a lot, especially during a really particularly difficult time in the nursing world. But as you'll hear tomorrow as part of the panel presentation, I still feel like there's a lot of hope for nursing, for our profession. I think we see that through our professional association and everybody's continued commitment to being here. I feel so much pride to be not just an RNAO member, but the president of RNAO, and to be able to represent our members as the president, and really am honored to be able to sit here and have people participate and in our AGM, even though I know everybody is really busy and has a lot of other things that are going on and a lot of competing priorities. I want to say thank you to Dr. Cooper Brathwaite, who was such an incredible mentor when I was the president-elect. Her leadership, her dedication to the profession of nursing and the people of Ontario really is exemplary, and it has been really rewarding to be able to learn from her and her immense experience across. I can't think of a single sector of healthcare that she has not worked, and she really brings all of that knowledge and experience with her. To Dr. Grinspan, who served as a mentor and a friend over the past